And what we're interested in this study is, so how do people appraise and understand their symptoms? How do they act on those symptoms? And then how do they communicate those symptoms to first, usually a primary care physician, because that's usually the first line that most people have in terms of their entree into the healthcare system. The interesting thing, because we've started the study, is that we're finding that for those patients that are coming into the system with these later stage tumors, these later stage cancers, that they actually are coming not in through their primary care physicians, but they're coming in through the hospital, through the ER, because they don't have primary care physicians, which of course tells us something about the healthcare system and the lack of health insurance, which has been, of course, a national debate and an important national debate. Doctors are trained to look for cues about symptoms. So if you tell your doctor that you have one set of symptoms, so say you're not feeling well or you have a headache, and you say, you know, I kind of have a headache. Well, they're trained in a certain way. So if you say, well, I'm kind of suffering from a headache and, you know, I'm not feeling too well, they'll say, you know, take 2 aspirin, go home. You know, it's probably the weather, it's probably your sinuses. If you say to the doctor, I have the worst headache of my life, that actually means something to them, and they're going to do something very, very different with you. So the second part of the study actually is going to be using trained actors to present their symptoms to real physicians who won't really know that they're actors that they're seeing, and see what happens and what those doctors then recommend about what those patients, those quote-unquote patients, should do. And that's kind of I think the really different part of the study, and kind of what we think is the really neat part of the study, to see what happens when people who look just a little different, and we're varying the patients, they all have the same story, but they're going to be varied by gender and they're going to be varied by race. The whole aspects of behavioral management is all geared towards helping patients have quality of life and get through all the treatments so that they can come out of the other end as survivors, as not only survivors, but people can go on with their lives in ways that they can sort of pick up where they left off before.